I'm Joanne Sanchez. We welcome you again to this week's edition of Your Active Life, your orthopedic educational community program. By my side, Dr. Raul Marquez.
Hi, Joanne. Hello, everybody, and thank you for joining us.
Our goal during this program is to provide you with some valuable healthcare information that will be beneficial for you and for your family.
To treat sciatica, we need to treat the cause. And again, not to be repetitive, but the most common cause of the sciatica is herniated disc, so we need to find out which disc is the one that is pinching the nerve, then we treat the disc. That brings us to how do we treat the herniated disc, and that's a big array of treatment, because contrary to popular belief, the herniated disc, 95–97% are treated with conservative treatment. And conservative treatment means something better than surgery or injections, something that is not aggressive. So we're talking about exercises, medication, anti-inflammatory medication, correct the problem, correct the vicious position. Also, the specific exercises for the back and neck, that will help. Water exercises are excellent. Strengthening exercises, I will call isometric exercises in your physical therapy, or any doctor can give you the exercises that would help to treat the herniated disc. Once that does not work, and we're talking about at least a minimum of 6 to 8 months and sometimes even longer, then we go to the more aggressive procedures. More aggressive procedures, talking about injections.
Okay.
Sometimes we inject the anti-inflammatory medication or steroid injections, which are very good for this type of problems. And once everything fails, then we go into surgery. And surgery, you can go from what we call the microsurgery to the most involved type of surgery, when we take the disc and we put bones and plates and screws, we call a fusion of this. But we're not talking about that right now, but that'll be just the very last resource after, a long treatment, non-surgical.
And what about the injections? Let's go back to the injections. How long, or what's the treatment like for the injections?
Injections are a very good option before we do anything surgical. And a lot of patients, the treatment stops right there, because sometimes they say, doctor, I've taken medications, I don't exercise, it still bother me, I have a lot of back pain and a leg pain. And then if we see that the disc is still inflamed, and that is the cause, sometimes the injections, and there are two types of injections. One is when we inject in we call an epidural steroid injections, and we inject just right below right on the tailbone and run all the way to in this area, to the lumbar spine. These injections are very good. Normally, I ask my patients that I will do 3 injections, and about 75–80% of the population will get better with that. And you can repeat them again at the proper time. Surgery.
Surgery is the last resort.
Yes.
Okay.
Yes, and like I told before, surgery is, there's so many different techniques. Now the most popular is the one that the least invasive we are, the better off the patient is. But they have such a specific indications, each one of them, that it will really require a lot of time to talk about each one of them. But I just tell most of my patients that this type of problem, herniated disc, back pain, neck pain, chances that they get surgery are very little, and that's why we're trying to help them with that. Yeah.
Stay with us. We'll be right back.
John, 64, 25 years electrical engineer, father to Richard, Mary, and Sam. Knee replacement surgery, April 2004. Jean, 62, 30 years teacher. Mother to Mary and James. Knee replacement surgery, February 2003. Don't let an injury slow you down. Call Dr. Raul Marquez today and get back to life.
The idea that exercise makes arthritis worse is a myth. In fact, the opposite is true. Exercise stimulates the cartilage and absorbs nutrients and repairs itself. Choose the right, low-impact exercises like walking and swimming, and make them your daily routine.
Welcome back. Now we're going to focus on MRIs. Let's talk about MRIs. What is it? Give us the whole definition, spill on it.
Well, first of all, as I told before, to make the diagnosis on this, we need to take regular x-rays, the x-rays that you take in your doctor's office. Okay. And then an MRI means, first of all, to understand what MRI is, magnetic resonance imaging. It's not X-ray, because people think, well, I'm going to have an MRI, doctor. Is this radiation? MRI has nothing to do with radiation. What MRI is a big magnet that picks up a very specific, very good images of the body. In the case of the spine, is probably the test that we need to, the primary test that we need to do to make the diagnosis of herniated disc or inflamed nerve or problems with the ligament on the bones. So basically it's a huge magnet, and the bigger the magnet, the more precise it is. The problems that we had at the beginning with our patients with MRIs is they were very close. There was an enclosed chamber where your body goes in, and then we take the pictures of the body. But now they have a new concept called an open MRI, and I think the public in general has taken into very quick, because it's not as claustrophobic. You know, they feel more comfortable. Mm-hmm. There's no injections. There's nothing. So more patient friendly. The most common problem there is that, you know, the patient feel uncomfortable because they need to sit there for a long time. Long time, talking about 30 minutes, 45 minutes, depending on the part of the area that we're taking with the MRI. Basically, that would really explain what MRI is all about.
Dr. Marquez, can we talk about herniated disc in this injury, this part of the
on the neck?
In the neck.
Yes. Like I told before, and you know, we were focusing on the lumbar spine, but on the neck is very similar. You can see that the disc is very, very little, but it can protrude and it can pinch the nerve, and as I told before, can give you some headaches because it's very close to the vertebral artery. Herniated disc on the neck is very common, and it's most common between the 5th and the 6th vertebra. And that will give you the neck pain, the headaches, but also will give you the arm pain. Instead of having leg pain, you will have back pain. You will have, arm pain. And you can have arm pain on both sides, and the pain can go to the shoulder, to the elbow, or to the hand. Most characteristically occurs in patients that, you know, they are in a vicious position, but also the most common complaint is numbness on the hands, and we have to distinguish if it's because of a pinched nerve right here, like a carpal tunnel, or a pinched nerve on the neck, and we do that by physical examination. But yes, pain really is a pain in the neck. It's easy to diagnose, but it takes some time to cure that or to improve. And again, we need to find out by MRI. We just talked about exactly what an MRI is, also by taking plain X-rays. And the treatment is more or less similar than in the back, but we consider now that the neck is a little different structure because basically we use them as support over our head. Mm-hmm. So it's very mobile. It can be treated a little different than the neck because we use the neck for everything. So that's basically the symptoms on the on the herniated disc on the neck.
Well, friends, we have come to the end of this program. We hope that this information will serve you as a tool to help you make important decisions for you and for your family. Once again, we'd like to thank Affectionate Home Care for helping make this program possible.
It is very rewarding to share this information with you. I would like you to remember that this program is for information and education only. If you have specific questions, please ask your doctor, or we'll be very happy to answer your questions at our office.